All right, time for today's Health Watch. As the Trump administration continues its push to detain undocumented migrants, some of them say they are avoiding health care, even necessary health care, out of fears over ICE raids. Well, now hospitals are preparing employees on what to do if ICE agents show up in the middle of care. Here to explain is CBS News medical contributor Dr. Celine Gounder. She's also the editor-at-large for public health at KFF, and Dr. Gounder joins us now. Thank you very much for joining us. Has this happened yet, or is it just fears of this happening, the kind of the raids while care is being provided at a hospital?
As for official raids by ICE, that is still something we are waiting to see if we're going to have that happen. But we are seeing ICE agents in healthcare facilities. They are often bringing in people that they've detained for medical clearance. We see this often with law enforcement. But it is creating an atmosphere of fear. And my colleagues and I have had numerous patients tell us that they hesitated or waited too long to come in for health care. So if you're talking about a heart attack, you're talking about heart muscle when you're delaying care. When you're talking about a stroke, you're talking about brain cells when you're delaying care. So those delays really matter.
You spoke with an emergency physician in Los Angeles, where I live, where ICE agents are bringing in detainees who need medical care. Let's listen to that.
Many times they're arriving with ski masks and looking very intimidating to the general patient who you might find in the emergency department. This is affecting the overall health of the community because it's creating an atmosphere of fear in the emergency department instead of an atmosphere of wellness.
So how else are you hearing ICE impacting patient care in LA?
So that was Dr. Hannah Janeway. They are an emergency medicine physician working at a number of different hospitals in the Los Angeles area. Dr. Janeway told me that ICE agents have insisted on all kinds of, frankly, ethical violations. So not showing their identification, not identifying themselves, wearing a ski mask along with green fatigues and a bulletproof vest in the ER while patients are being seen, not accommodating the need for patient privacy during an interview and examination, preventing doctors from contacting family for necessary medical information, or preventing family from visiting. So these are really standard things that every patient should have the right to these kinds of provisions for good health care.
In addition to the physical health, I mean, what is the medium to long-term impact on mental health of these patients with this kind of fear?
Well, if you think about who has come here as an immigrant, many of them have faced real trauma in their home countries. It could be physical violence, sexual assault, any number of things. And so this kind of really what feels like militarization of an emergency room can be very re-traumatizing, cause some very real mental health impacts. And we've heard of also even children and families being impacted by their older relatives not being able to seek care.
What are the obligations of patients when they show up at the hospital? Do they have to show an ID? Do they have to identify themselves?
No. So in fact, we have a quote Jane Doe or John Doe on the emergency room board all the time. So, you know, if you pick up a homeless person on the street who needs medical care, they may not have an ID. In fact, a lot of patients don't have an ID. That's not who needs to be presenting ID. It's if you are a law enforcement official coming into a hospital or healthcare facility, you need to be identifying yourself as such. You need to be showing your badge or your ID. And that is, you know, if you want to be going into private patient areas, you also need to be showing a judicial warrant. And that is not being consistently done.
Do you expect to see quickly, you know, any pushback in the courts on this?
Well, I think the problem is a lot of healthcare providers don't know what their rights are, and they need to be saying, you know, where's your ID, where's your warrant, turning into risk management for advice in the hospital if they need that, and documenting thoroughly, as we would in any complicated medical or legal situation, documenting those encounters thoroughly.
Dr. Celine Gounder, thank you so much for your reporting. We appreciate it.